Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Look, menopause is a topic not many women like to discuss, but it happens in their late 40s and 50s. For some women, just saying the word menopause can increase the levels of anxiety. Change is never easy, especially as we get older. Dr. Karen Knapp is with the Commonwealth OB GYN Specialists, Henrico Doctors Hospital. She's here to talk about the change every woman goes through, menopause.
We can't avoid it.
You can't avoid it.
No matter how hard we try, Chris, it's going to happen to us. It's a normal part of the aging process, and it absolutely can evoke a lot of fear in women if they don't know exactly what to expect. And a lot of times they've heard some pretty horrible stories from their mother, their grandmother, their aunts, that type of thing. Nobody ever wants to tell them that it's easy. But it's an important thing for every woman to understand you can't avoid it and to appreciate what it means to them, not to be afraid of it, and to have a practitioner they're comfortable going to talk about it.
I was saying earlier, the only thing I really know about it is that every time mom comes over and visits, she says, I'll need something to fan with
That's right.
But it's much more than hot flashes.
It is, but it's the hot flashes, the vaginal dryness, the mood swings, the sleep disruption. Those are the symptoms that actually get patients into my office. They'll come in and say, Dr. Knapp, I'm doing okay with the rest of it, but when I can't sleep at night, the rest of my life falls apart. I can't function during the day, or I'm embarrassed. I'm in a business meeting and I'm embarrassed because I'm sweating. What can I do about that?
Well, you kind of read my mind, because I was going to say, what are some of the treatments out there to make this transition a little easier?
Well, fortunately, menopausal medicine has come a long way. Up until the 1990s, it was considered a disease because our ovaries failed us and we were short in estrogen. Menopausal medicine is now a recognized specialty with a certification even to go along with it. And there are a number of us in town who are certified. So what you can do about it, the gamut has become so much more generous. I like to start with things like complementary and alternative medicine, yoga, relaxation, mindfulness, deep breathing. That can help women during some of the times. The Food and Drug Administration recently approved the first non-hormonal medication for hot flashes and for menopause symptoms back last in the fall of 2013. Additionally, there are more selective estrogen type of medications that can be used. And finally, there's hormones. I kind of think of myself as a chef in the kitchen, and I pick a little of this and a little of that, and depending on what's bothering your mom, Chris, and I'll throw that in, and maybe we'll buy a fan and that type of thing. So let me see.
So
her.
there is help, right?
There is help, absolutely, absolutely, absolutely.
All right, Dr. Knapp,
It's
thanks so
my
much
pleasure.
for joining us.
Come see us. Take care. Thank you.